Hey guys, Health and Wealth Volume 4. This is just going to be a very short video on trying to motivate you guys to get healthy, at least better than you are now. This one is that list we went over in the other video. We skipped over one thing, and it's the 20 diseases and conditions directly attributable to being overweight. So without further ado, I'll jump right in it. Number 1, diabetes, a disorder where the pancreas is not producing enough or sometimes not any insulin. Diabetes can lead to a whole host of other medical issues, and obesity is one of the main causes. 2, cancer has many different forms and types. Many of them could be prevented with more attention to eating healthily and avoiding obesity. 3, congestive heart failure is a condition in which your heart can't pump enough blood to your body's other organs, also called a slow death in most cases. 4, enlarged heart is another heart condition where the muscles of your heart becomes larger due to being overworked, which naturally happens if you are overweight. 5, pulmonary embolism is a sometimes fatal blockage of an artery. Being overweight causes most people to reduce activity, and after time, lack of activity can result in embolisms. Number 6, polycystic ovarian syndrome is a condition in which cysts develop in your ovaries that can burst, causing even further problems. Number 7, gastroesophageal reflux disease happens when stomach acids and juices flow from your stomach back up into your esophagus. It is common in overweight people. Number 8, fatty liver disease is a reversible condition in which large pockets of fat accumulate in liver cells. 9, a hernia is caused when the hole in a diaphragm weakens and enlarges. 10, erectile dysfunction is the inability to develop or maintain an erection, which can be caused by a medical problem due to obesity. On a side note on that, a lot of people don't understand this. Erectile dysfunction in a man can be a sign of some serious things, because basically when you start getting plaque in your arteries, you start building up fat. Some of the smallest veins and vessels that we have are in the penis, and those will start to plug first on many occasions and lead to penile dysfunction. That can actually be a sign of something. You're beginning to get some serious blockages, because they are the smallest arteries, so they will clog first. So that's an important one for guys. If you're on a little blue pill, you might just be turning your back on what is a serious problem beginning. Number 11, urinary incontinence is the inability to control urination. It is frequently associated with obesity, weak bladder, and pelvic floor muscles. 10, chronic renal failure, meaning your kidneys fail to work, is a much greater risk to those who are overweight. Number 13, lymphedema is a condition that occurs from the damage or dysfunctional lymphatic system, sometimes caused by people suffering from obesity actually crushing their own lymphatics. And I'm actually going to do a video about the lymph nodes. They're very important. They're basically a separate circulatory system in the body that help move sickness and disease and and they have no circulation of their own, though. They can only be circulated by movement. So the more you move, the more you circulate your lymph node system. And it's what helps you stay from getting sick. It's like your defense system that sits on top. Number 14, cellulitis is a spreading infection involving both the dermis and the subcutaneous skin tissue, resulting from poor lymph flow caused by obesity. So now there's two conditions that with the lymph node system. 15, stroke is caused by a lack of blood supply to your brain. 16, Pickwickian syndrome is characterized by sleep apnea resulting from obesity, placing an excessive load on your pulmonary system. Number 17, depression is a condition where a person feels miserable constantly, even to the point of being suicidal. It can be worse for someone who also has a weight problem. 18, osteoarthritis is a clinical syndrome in which low-grade inflammation results in pain in your joints. It is caused by abnormal wearing of cartilage, oftentimes due to obesity. And a side note of inflammation, the stuff we eat makes us inflamed. That's why you have bloating and you have kind of a redness to you sometimes. And the more you stay inflamed, the harder it is for your body to get to a status quo. And that's very problematic with cancer, inflammatory diseases. 19, gout. I knew a guy who had gout. It was very painful, he said. Occurs when uric acid accumulates in your blood. Nerve endings then become irritated, causing extreme pain, which is made worse by carrying extra weight. Number 20, gallbladder disease commonly affects overweight people as a result of high blood cholesterol levels, which cause gallstones. And this is, according to a Surgeon General report, obesity is responsible for 300,000 deaths every year. So there you go. I'll keep this one short. That's the top 20 conditions that are made or made much worse by having a obesity in your life. And he goes on to point out the approach you should take to help yourself get better. I've said this before, but it's important, so I'll say it again. There is no magic pill that will make you lose weight, although researchers did decently come out with an exercise pill, if you can believe that. Weight gain is obviously influenced by many factors, but the two that everyone keeps coming back to, diet and exercise, are still the major players in my mind. Combine a healthy diet with exercise and be sure you are addressing the emotional component of food, eating, and weight gain, and most people will lose weight. Making up your mind to do it is half the battle. In fact, it's probably 99% of the battle for many, and this is why tools like the emotional freedom teaching technique are your friend and ally when it comes to losing weight, to help you nip emotional eating in the bud by dealing with your feelings at an energetic level and creating a new relationship with food. That is one step of the weight loss equation. From there, it's just a matter of changing your lifestyle in the following ways. 1, tailor your diet to your nutritional type. These are the foods that are right for your biochemistry, and I am a firm believer in that. And these are the foods that will push your body towards an ideal weight. By the way, these foods may be high in fat, high in carbs, heavy on protein, or heavy on veggies. It depends on you. Eating right for your nutritional type is not a diet. In fact, if you still feel hungry after eating, you are definitely not eating according to your nutritional type. There is no food deprivation, no counting calories, and no starving yourself. 2, view exercise as a drug. When you are trying to lose weight, a casual walk here and there is not going to cut it. Many studies find that exercising for an hour 5 days a week is actually what is needed, and I tend to agree with that. Sometimes you may need up to 90 minutes of aerobic activity. There is also strong compelling evidence that strength training and high-intensity anaerobic interval training may be especially effective for weight loss. So there you have it, blah, blah, blah. Yeah, there is a book called Eat Right for Your Blood Type, and I think there may be some truth to that. There's natural chemicals in your blood that other people may not have, so you may need to eat different nutrients to effectively make you healthy. You know, let's say that vitamin D, probably a bad example. Let's say testosterone. Let's say that they found that tribulus seems to kind of help with testosterone. So if I have a level here and you have a level here, and we both need to be here, I have to maybe eat or work out harder, or my blood, for whatever reason, my biochemistry doesn't allow me to make as much. So, but if I work out an hour and a half, I release testosterone in my bloodstream, and that helps me get up here. See, so he may only need to exercise a little bit to get up here. I may need to exercise a lot more than he does. So that's all I'm saying. There's some truth to that. But like I said, I'm gonna keep this one short. Those are the top 20 things that can happen to you over time through obesity, not counting the effects of the evil foods you may be eating. God bless.